Esophagus. This is a hollow tubular organ connecting the pharynx to the stomach. It serves to conduct food masses. Length of an adult esophagus is 25-27 cm. Its location. 1. Begins CSC 7 vertebrae. 2. Enters the stomach at the level of T9-T12 vertebrae. 3. Lower boundary is 1-2 vertebrae higher in women than in men. Topography of the cervical part of the esophagus. 1. Front lies against the membranous wall of trachea, left laryngis recurrens nerve passes. 1. 2. Back lies against the spine and long muscle of the neck covered by vertebral lamina of the cervical fascia. 1. Sides nerve and blood vessels, common carotid artery, internal jugular vein, vagus nerve, * topography of thoracic part of the esophagus. 1. Front membranous wall of trachea, arch of aorta and beginning of main left bronchus. 2. Between the bronchus, esophagus and the posterior wall of the trachea lie the bronchoesophageal muscle and ligament. 3. Behind spinal column, thoracic duct, azygos and hemiazygos veins. 4. Thoracic part is situated in front of the aorta. 5. On the sides vagus nerves, left nerve anteriorly and right nerve posteriorly. 6. The right surface is covered with the right mediastinal pleura. This pleura and the lower 1/3 D of the esophagus connect with the pleuro, esophageal muscle. Topography of the abdominal part of the esophagus. 1. Passes obliquely down from the esophageal hiatus of the diaphragm to the stomach. 2. Position of vagus nerves are similar to that of thoracic. 3. In the abdominal cavity, the esophagus adjoins with the left peduncle of the right diaphragm and the caudate lobe of the liver. 4. Abdominal part is covered by peritoneum on all sides most of the time. Curves of the esophagus. 1. Frontal plane to the left below C6. 2. Towards the midline level of T2-T3. 3. Sagittal plane between C6-T2, corresponding to the curve of the spine. 4. Frontal plane beneath C2. 5. Front passing through the diaphragm. Narrow regions of the esophagus. A. Region of pharyngoesophageal transition behind the aorta, T4. B. Region of the esophageal foramen of the diaphragm. C. Region behind the left main bronchus. Sometimes all 4 layers are present in the esophagus. Upper 1/3 of the esophagus is thinner than the lower 2/3. 1/e mucosa of the esophagus has glands. They contain mucus glands. Upper part of esophagus has skeletal muscles which gradually get replaced by smooth muscles in the lower regions. Internal muscle layer is circular and external is longitudinal. In the cervical part, circular is 2x thicker than longitudinal. In the thoracic part, both layers are equal, and in the abdominal part, longitudinal is thicker. These layers provide peristalsis. Adventitia is best developed in the region of the diaphragm.